Hey, chiropractors, welcome to Modern Chiropractic Mastery with your host, Dr. Kevin Christie, where we discuss the latest in marketing, business, and professional growth with some of the leading experts in the industry. Welcome to another episode. Today we actually have a MPI Mastery Spotlight. Every so often we do these episodes on docs out in the field that have done a ton of great work helping out in the MPI Motion Palpation Institute world, and just a lot of other endeavors in helping out patients and fellow chiropractors and other colleagues. And today's guest is no different. He is an industry transformer, has done way more than just patient care, but that is part of his passion. And this is Dr. Tom Michaud, and he is in Massachusetts, but a lot of you may know him from his books he's written. We dive into his 40-year career he has had and everything he's done and is doing and keeps on pushing the envelope. And so it's an enjoyable conversation where we get into everything from some clinical foot and ankle stuff, like we dive into the nitty gritty with that. We talk about the kind of the span of 40 years of being a chiropractor. We talk about some different strategies and ideas of how to grow maybe a practice that's centered around foot and ankle, or connecting with other providers that work with foot and ankle. And so it's a very wide-ranging conversation, and it's enjoyable to see. I always like to see how, people progress over the years of a career. And so we dive into some of that. He's a wealth of knowledge, as you can see by listening to this episode. Well-read, well-written, has written some very extensive books, and it's been a great resource for me in my career. And so here is my interview with Dr. Tom Michaud. Before we get to the episode, I want to tell you about my friend and colleague, Dr. Holly Tucker of ChiroNumbers.com. Have you been in practice a few years now and you're wondering when your business will start to reward you financially? Are you so overwhelmed with the day-to-day business management that it is hard to see your success? Or are you trying to expand your team and worried about the impact to the bottom line? Dr. Holly is a certified profit-first professional and a chiropractor herself, who has managed multiple practices over the past 10 years and consults specifically on implementing the cash flow system of profit first for chiropractors. Simplify the way you look at stats, metrics, and your own compensation through this methodology by working with someone with unique experience in your business model. Visit bit.ly/chironumbers to get your guide and video training. Download the first 2 chapters of Profit First and subscribe to her weekly 5-minute Friday series on profitability. Start to feel less overwhelmed, avoid burnout, and clean up your finances so you can focus on patient care. Again, that's bit.ly/chironumbers for access to Dr. Holly's resources. I hope you enjoy this week's podcast. All right, welcome to the show, Tom. I really appreciate your time today. Before we dive into years of progress and clinical and all the things you've done professionally, tell us a little bit about yourself and we'll go from there.
I started chiropractic school in 1978, a long time ago, Western States, it was called back then. And it was a great experience. Mike Carnes was an anatomy teacher. Villeneuve was taught biomechanics. We had great nutrition teachers. And I felt it was a really great education. I got out in 82, came to Boston, and it's gone by in like the blink of an eye. I can't tell you how fast the last 40 years have gone, because it's been fun.
Yeah. And so you've been in Massachusetts the whole time, right?
Yeah, I was just outside of Boston in Cambridge for 2 years as an associate, 82 to 84. And then I opened up my practice in Newton, just outside of Boston, in 84.
Nice.
Yeah.
And so in private practice, you're one of the ones I consider, and this is the MPI Mastery Spotlight. And a lot of times we try to, spotlight some of the ones that have been industry transformers in the sense of, more than just the private practice, which is great, but you've done a lot outside of that. And we'll touch on that. I know my initial introduction to your work was through MPI, and a lot of the foot and ankle stuff I've always been extremely fascinated with the foot and ankle and how it relates to a lot of the clinical things that we see. How did you get to that point where you really started to hone in and become, let's say, fascinated and then really focus on foot ankle?
Uh, it started when I was in my teens, actually. My mom applied for a job when, I was in high school, and there was an opening at an orthotic lab by Dr. Sheldon Langer, a podiatrist in Long Island. And he started Langer Laboratories. My mom started there when it was just a few employees. And within 10 years, that turned into like a massive orthotic laboratory. It's very successful. Dr. Langer was a great guy, and I learned a lot about orthotics because I worked there off and on. My brother worked there all the time. He has his own lab now, Allied Orthotic up in Londonderry, New Hampshire. So it's
Mhm.
been a family business for a long time. But I didn't want to become a podiatrist because I just always loved chiropractic. And
Mhm.
it was a really nice blend when, especially back then, there were so few people who knew anything about biomechanics. If you knew how to treat foot ankle problems, especially like orthotics are just a small component of treating foot ankle problems. If you knew how to manipulate, mobilize, strengthen, you saw every runner in the country. Like people, even 2 years into practice, I was having people flying in from other countries to see me. My practice just took off.
Yeah, it was something I've focused on a lot with my background of learning from you and through MPI and the GATE seminars I was going to. I graduated from Logan in 2005, and so from I think '03 to '05 when I was a student was taking a lot of those courses and focusing a lot on that. I am active release technique trained, and so that helped a little bit for me. And I definitely down in South Florida where I practiced for the last 18 years, I've treated a lot of runners and I've had a lot of collaborations with some good podiatric surgeons, more maybe some of your traditional podiatrists that don't do surgery. I've had a good relationship with them
Mhm.
because they've even seen that missing link in their repertoire was that hands-on approach potentially. And honestly, a lot of them didn't have the time to
Yeah.
assess biomechanics properly even, right? Like
That hasn't changed. In fact, it's getting worse. I've seen it over the past 20 years. Like the knowledge base for clinical biomechanics, people are just too busy. Medicine is too stressful.
Mhm.
And like when you're good at this stuff, and like, every now and then someone needs surgery, I've got a half a dozen surgeons in town that I really like, I really respect. When you write them notes saying what you're finding and saying what you've done with strengthening, they will fill up your office because they know that they're not doing a great job. A micro neurosurgeon who sends me whenever someone has their fingers lost in a work accident,
Mhm.
he transfers toes to hands and does
Mhm.
all this amazing stuff. He sends me everybody that he does these surgeries on because he knows there's no one else out there.
Mhm.
And a lot of the other big sports guys, when they see you're doing nice work with agility work, strength training, manual, they know there's a shortage of it. And, physical therapists are filling that gap a little, but, a 10% of our profession is just amazing. And there's such a need for that type of practitioner.
Yeah, there is, and it's a niche that obviously it can be filled, and I think sometimes chiropractors forget that, right? Like,
Hmm.
everybody thinks of us as neck and back. I mean, that's just
Right.
the reality.
Hmm.
Even though if you do a good job of differentiating yourself with other types of conditions, they think of neck and back. But if you do a really good job with a particular body part, in this sense, it's so instrumental in the whole thing that you can just start getting a ton of referrals and be known for that. And it doesn't mean you can't treat other things,
It's funny because I wrote that book in the 90s, Foot Orthoses. A
Mhm.
lot of the local docs, a lot of local chiros started sending me all their foot ankle patients. And I know as much about wrist, shoulder, neck as I do about foot ankle. I kind of started getting offended that people started thinking I was just the foot ankle guy.
Yeah.
So, I wrote some articles on vertebral artery dissection. I wrote some articles on biomechanics of the glenohumeral joint. And I actually deliberately tried to get away from just doing foot and ankle because it started getting a little boring. I'd just done so much of it.
Mhm.
And then I got so busy that I just had to close down the new patients for a long time so I could pick and choose who I saw.
Yeah, now let's diverge a little bit on that, and we'll kind of come back because obviously you've done a lot for the profession and even other professions, obviously with your books and courses and over. Let's just take the last 20 years. How much of your time has been split up with like traveling and teaching and courses and writing versus clinical care?
That's a good question. I just had more energy when I was younger because I worked full time. Like when I wrote Foot Orthoses, I was in my 30s. I
Mhm.
was probably seeing patients 50 hours a week and
Wow.
then putting 15 to 20 hours a week writing. So I just have had just endless energy. I just also found the stuff fascinating. And I lectured a fair amount in the 1990s, but I never enjoyed lecturing. I'm like a private person. I just
Mhm.
like quiet. And I don't like getting up in front of people.
Mhm.
So I just wrote. I did some lecture stuff, continuing ed, through the 90s. But
Mhm.
then I kind of pulled away from it from 2000 to 2010. And then I decided to do another edition. I wrote Human Locomotion.
Mhm.
On average, a book takes 4 years to write. They have
Mhm.
400 to 500 illustrations in it,
Yeah.
and 3 to 4,000 references that you cull down to 2,000 references. So, yeah, I'm just kind of like an odd guy where I could just sit in this room and just read and write all day.
Well, it's a good point because I'm actually looking at the human locomotion book too. And to your point, yeah, there's a lot of effort in that, and it's just it's so well done, and it takes time to do that. There's an interesting saying. There's an author, Cal Newport, who he wrote a book, "Be So Good They Can't Ignore You," and he got that from Steve Martin was being interviewed, the comedian Steve
Yeah,
Martin, and the whole thing was like how Steve Martin got, become the Steve Martin that we all knew. And his answer was simple. It was like, be so good they can't ignore you.
I love that line, by the way. I've seen that before, and I've always thought Steve Martin was hysterically funny. He
Yeah.
also didn't like performing, which I relate to.
Yeah.
But yeah, I love that logic.
Yeah.
Uh, but I didn't do it, and I think most people like him and other people who've made it, I didn't do it with a goal of being successful. I
Mhm.
did it because I just like doing it.
Mhm.
And that makes all the difference in the world. In fact, when I did foot orthoses in the 90s, it was kind of funny. I was writing some articles for Bob Hazel at Chiropractic Sports Medicine, which had a short-lived career. It was our profession, chiropractic's only sports medicine journal, and he had some nice articles in there. But he connected me with Williams and Wilkins Publishing,
Mm.
and I figured I'd write a book on orthotics and lower extremity. So I start writing this thing. It's taken forever. It took me 4 years to write it, like with a lot of time going into it.
Mhm.
And I didn't realize it, but there were no medical publishing companies that had really published any books by chiropractors. There was pressure in the industry to not do it.
Mhm.
But Yoakum and Rowe did that phenomenal 2-volume skeletal radiology text,
Yeah.
and Williams and Wilkins published it. So at the time, I think there were 30,000 chiropractors in the country, and the editor from Williams and Wilkins told me 27,000 chiropractors bought that book, which normally, like, only if you write a book on cardiology, 1 in 100 cardiologists. He had all the stats on which professions buy the most books, and chiropractic was number one. And so
Hmm.
they wanted a book. Bob Hazel talked to him because they were working with chiropractic sports medicine, and he was funny. I sent him a sample chapter, and they liked it. And he said, "Do you think you could get us the rest of this within 1 to 2 years?" And
Mhm.
I said, "I could get it to you tomorrow." And he goes, "You wrote a book without having it approved?" And this was before you could publish anything on Amazon. It would
Yep.
have been a waste of 4 years. And I was like,
Wow.
"Yeah, I didn't really think about it." And he
I
just
guess
started laughing. It was
yeah,
funny.
I guess you learn a lot though writing a book, right?
Oh yeah, that's that old line. If you want to learn something about a subject, write a book on it.
Yeah, and I want to touch on a little bit for our audience. I always try to extract some things that they could maybe apply to their own practice growth, and it just shows like you don't have to be out. on video all the time. Video is great. Public speaking is great. But if you happen to be more of a reclusive person that is quieter but is really good at writing, you could be writing stuff for your local community and really position yourself as an expert in the community based on your writing. And it
Right.
doesn't have to be 4 years of a book. It can be, right?
Yeah.
But you can really do some strategic writing if that's your sweet spot, and it can uh, grow your practice and obviously position you well.
Yeah, especially there are certain subjects that people want. People have attention spans where no one wants. I've been writing articles for dynamic chiropractic for a while,
Mm-hmm.
and the length of the article that they wanted keeps getting shorter and shorter, from 2,000 words to 1,500 words. People are busy, and if I see a crazy long article, I'll put it aside and I'll eventually get through it.
Mm-hmm.
But I like, if you wanted to write an article on posture, or you wanted to write an article on carpal tunnel syndrome, local places are interested, and you just got to, reach out to people,
Yeah.
But there's a real market for it. And now, I mean, with Instagram, with everything else,
Mm-hmm.
you could just put out there whatever you want.
You can, and it makes it tricky too, because I actually wrote a book, Doing It Right, Modern Chiropractic Marketing, and Parker University published it for me. And, it's not as voluminous and in need of a bunch of research and that type of stuff, because it's not a clinical book. So that definitely shaves off a couple years. But, it was a lot of effort, and it was a lot of paying attention to detail and getting references and getting approvals and a lot of those things. And I wanted to make sure we did it did it right and made it nice. And so I learned a lot in that process. And I see that, a lot of people will write purely for marketing, right? And you can tell the difference.
Right.
And that's fine. Like if you're writing a blog for your website, your chiropractic website, and you're trying to get SEO and all that and bring awareness to your clinic, that is totally fine. But I think if you're really going to try to use writing as your means of separating yourself, you're going to have to put a little bit more effort into it, a little more substance. It doesn't have to be, like you said, lengthy, but it's going to have to be compelling, right?
Mm-hmm. Yeah, absolutely. And finding those subjects, and maybe look for trends, but you really just have to do it because you're fascinated in the subject. And right now, there's just so much out there now. To me, it makes it enjoyable because it's easy to find references. It's easy to find good stuff. And what I like about all the writing and all the different things that I've done is I've met some really interesting people. I mean, you interviewed Brett Winchester, Mark King, all great guys. I mean, I just practiced and didn't look up for decades. And in the last few years, I've been meeting some really great guys. Trainer Andrew Hauser used to be with the Dodgers. He's in Phoenix now. Nick Studholme, chiropractor in Colorado. Jen Perez and Courtney Conley with Gait Happens. Just really interesting people who are doing good things for the profession.
That's great. It's really cool getting out there nowadays. And I've got a business partner in the Chiropractic Success Academy, Dr. Bobby Maybe, who we actually became business partners without meeting in person.
That's pretty cool.
We have now. Subsequently, we've met in person many times, but prior to that, we hadn't. And so
here, prearranged marriages have lower divorce rates than when you actually get to know the person.
Exactly. So yeah, in today's day and age, you can definitely collaborate and meet with a lot of people. So that is definitely cool. All right, docs, here is a new opportunity for you from Darcy Sullivan of Propel. She is our SEO specialist in helping out many chiropractors with their search engine optimization and making sure Google is finding you and getting you new patients. It's amazing how many new patients chiropractors can get and are getting when they do the SEO right and a few other things. And Darcy is offering a free SEO workshop just for chiropractors, and you can sign up for that at bit.ly/propelmcm. That is bit.ly/propelmcm, modern chiropractic marketing, right? And so check out that link, and we're going to have you go over 5 SEO secrets to owning the first page of Google without buying ads. And Darcy's going to give that free workshop, 1 hour, to really help grow your practice and start churning new patients from the ever mighty Google, which is still king in the online marketing. So check that out at bit.ly/propelmcm for the 1 hour free workshop. Hey doc, are you moving office spaces, or you're a startup with your own new space, or you're like me where you need renovations because it's starting to look a little worn after about 10 years like ours is? Crossfield's Chiropractic Office Design is here to elevate you wherever you're at, and they're going to help maximize your space and flow. They're going to really help attract and retain patients, and this is going to have a great ROI on your investment when you increase that patient experience. So check out Chiropractic Office Designs by Crossfields, and we have a special link for Modern Chiropractic Marketing listeners, and that is www.chiropracticofficedesign.com/Kevin-Christie. And with that, you're going to have discounts. We're going to have direct links to a mega bundle of free resources, and you can check them out, and you can get 15 of our most popular floor plans, 5-phase checklist for a startup office, 5-point designer checklist to evaluate your current office image. And there's 30% off on all online products when you go to www.chiropracticofficedesign.com/Kevin-Christie. I want to segue a little bit and get back to what we talked about with, growing a practice, and whether it is foot and ankle or not. But let's hone in on that for a minute, and working with other people in the community, podiatrists, maybe it's podorthists and other types that are working with foot and ankle. For the chiropractor that's in our audience that does have some good skill set around the foot and ankle, what would be some of your strategies for them to try to connect with other professionals and get those types of referrals?
I find that most medical docs now are so overwhelmed with getting through a day, and they know their shortcomings, which is conservative care.
Yep.
And with GPs, it's pretty much everything. And what has always worked for me, and I never did it on purpose, I would just write short notes up after I saw somebody. And I would write what I found in the biomechanical examination. I would talk about weakness, and then I would just say what my goals were. And I would throw manual therapy, manipulation in there. And 30% of them loved it. They tended to be some of the best people in town. And then they started sending me patients, but mostly patients grew. Like, I wouldn't want to have to reach out to the medical community for survival in a practice personally. I feel that when you do a good job with each individual patient, it grows on its own. I mean, word of mouth. There are so few people who are really skilled at their craft, and not even skilled, just if you're enthusiastic and you care about people and they see it. From what I've seen, looking at different associates that I've had and different friends who practiced, you do well when you want to get people better. And people talk about it, because PTs are getting beat up. Everybody's getting beat up with the healthcare industry. So it's hard to have empathy, all day, every day. But when you really care about getting people better, they're appreciative. And when you study, like when they see that you're looking stuff up, I'm constantly saying, would you like a paper on this? Someone did this article showing that if you had a strength imbalance, it led to this. And no one ever wants them, which always surprises me. But yeah, they go, at least they know that I'm looking stuff up for them.
Yeah, and it just seems like, if you had to categorize yourself as you're kind of an educator, right? Like,
Right.
whether you're educating other doctors or you're educating your patients, it's just become that consistent educator, and enough people will really listen to that and take that and spread that information for you.
Good point.
And do that. I definitely
Absolutely.
think that. And I do hear a lot of chiropractors they do reach out to MDs. They do try to get some MD networking, but ironically, they tend to forget about the DPMs that they could, if they're going to get out there and connect with other doctors. That is a good potential resource for them, because a few things I've noticed is a lot of the DPMs don't have physical therapy on site. Some do,
Right.
but not as much as the ortho.
Right.
So they don't necessarily have PT on site. Another
And
one,
the DPMs are very well connected to the running community, and
Yeah,
they know a lot about clinical biomechanics. And, you know, the good ones are the same as us. They want to get people better. So they will send out and you know, and a lot of chiropractors don't want to take the time to get skilled at orthotics or anything else. No, you have to have a good group of podiatrists and a good group of orthopedic surgeons that you know and trust, because it's essential and it's a two-way street.
It is. It's a great collaboration. And then the other thing I've found with DPMs a lot of times is they get patients that come in with lower leg stuff, I'll just call it. And a lot of times it's just maybe a radiculopathy from the back, and
Yeah.
a well-trained DPM will know that, and they should have a really good chiropractor to handle those lumbopelvic issues that are causing it. Because obviously the patient doesn't know, like, oh, you know, I got some numbness and tingling in my lower leg and foot and ankle, whatever. They just think it's a foot and ankle issue. So there's a chance they're going to go to the DPM, and a good DPM is going to know it's not from the foot and ankle, and they need a referral.
Yeah, but at the same time, like I said, I've been practicing for 40 years. I know a ton about foot ankle biomechanics.
Mm-hmm.
I don't get many referrals from DPMs. You know, I send out to DPMs more than they get sent back to me. And I just think that they're in business. Their goal is to do surgery. And that's their mindset. And, you know, there's the occasional one who's often an athlete, him or herself, that realizes the importance of it. But yeah, it's
it can be strategic sometimes. You have to find maybe the one
right.
that has more of a conservative tilt to them, right?
Right. Yeah. Often they're a patient.
That's true. That's true. I've had that.
Yeah.
I've had that for sure. That's cool. All right. So 40 years, right? 40 years of practice.
Yeah.
And before we hit record, you were kind of mentioning that this will be the final year. So tell us a little bit about that.
Yeah, I'm just deciding. I started that other company at humanlocomotion.com. I patented that foot ankle strengthening device, which called the Toe Pro. It's just taken off. Every NBA team is using it. The NFL is starting to using it, and physical therapists. It's just been really popular. My wife runs the website. We know absolutely nothing about running a business other than chiropractic. And this thing has grown, you know, meteorically by itself just because it works. Like every professional distance runner in the country is using it. Temple University, the podiatrist there, Dr. Song, is a great researcher. He just finished up a paper on it. 6 weeks, 25 people did strengthening. They had increased force output beneath the medial forefoot, increased toe strength. And the main thing it does is it increases horizontal jump distance. And that's why every NBA team is using it now. The women's NBA are using it, and, you know, runners, because toe strength correlates with agility, it correlates with speeds. I made this thing because of the research showing that you can prevent falls in the elderly if their toes were strong. And Goldman did a study showing that if you exercised, he looked at strength gains when you use like TheraBands. That was a separate study where if you're plantar flexing the muscles in a shortened position, you barely got any strength gains, because in order to stimulate satellite cells to reproduce, muscles have to be lengthened. And Goldman did a simple study. He cocked the toes back 25 degrees. He had them do isometric contractions. He got 4 times the strength gains. So I made a series of like tilts and angles on a foam block that I then routed out certain positions to change the durometer. And we were able to very effectively strengthen the most important muscles of the foot ankle in their lengthened positions, and the outcomes have been amazing. And word is catching on. So that business, as it grows, I'm having a hard time, because like I said, I'm getting old. I'm having a hard time working in the practice and then dealing with everything associated with that, because I also have a half a dozen other products that I'm making.
Yeah.
So that's been interesting, because I've had to deal with manufacturing. I've had to deal with going overseas for some things. And like I said before, I've got to meet some really interesting people. But now I'm at a phase now where I've practiced enough. I want to start writing. I want to start like illustrating. And I'm looking forward to having a change. I probably won't be able to completely retire just because I like it. But I'd still like to. I might just do 1 day a week or something. But you know, it's all up in the air right now. But I'm setting a date for like leaving the office the end of the year.
Nice. I'm assuming this also works with golfers, right?
Yeah. Anything where to be surfers, the biggest group that makes the largest bulk purchases are Irish dancers, which which I think is pretty cool. Oddly enough, it doesn't increase vertical jump height because that's gastroc and soleus through the forefoot, but it
Uh-huh.
increases horizontal jump height where
Uh,
you are driving forward. That's why an NFL team just made a bulk purchase last week, and I wrote the guy who bought it and said, the front four when they're down in that squat,
yep.
it's all toe strength with the toes in a dorsiflex position.
Yep.
So, and it's been, I've made so many products. I've always made stuff. I made
Yep.
rock boards for you. None of it's ever sold. I made that medial drift device where you could met. A study came out of Shenandoah University. It had great inter-rater reliability. It predicted foot architecture. If they ever did a bigger study on it, it would predict injury. No one was interested in it. Which I'm fine with.
Yep.
I just make stuff for the same reason I write.
Yeah, no. And what was the name of this product?
That was called the medial drift device. It's anodized aluminum. It measures inward rotation of the medial malleolus as the talus adducts during as you go from neutral position stance to relaxed calcaneal stance.
Okay, and
So,
what is the most recent product as well?
oh, the Varus Post is probably the most recent products that I made. Research came out that orthotics decelerate the velocity of pronation and do all these wonderful things, but because they support the arch so much, they can cause intrinsic arch weakness. So they showed that a wedge, which is just a tilted crepe wedge that goes under an insole, decelerates velocity and can decrease tibial rotation, whereas the arch support in an orthotic distributes pressure. So basically the post and the shell do different things. So for those people who just wanted to decelerate the velocity of motion, say you had a neutral foot, but you were having chronic Achilles or plantar fascial problems, you just put this Varus Post in, and it's peel and stick. You put it under the insole, works unbelievably well. So I made Varus Post, valgus posts. I made interdigital balances to take pressure off sesamoids, and then another balance to treat interdigital neuromas. So
Nice.
super easy, quick, and it's for people who don't want to put the time in to become great at making orthotics, but you want to get those positive results that orthotics can give.
Yeah, and I think one of the great things too is you not only do you have the products, but you have the education to educate the doctors on when to use this type of stuff and why and all that. So, it's not just about throwing a product in without knowing what to do with it.
And it's less expensive. So
Yep.
it's a win-win. It's quick for the doctor. Patient satisfaction is through the roof. If you're treating an Achilles injury and you throw that in there, like 90% of the people it works on. And you can use it, they're inexpensive enough. You could just use it temporarily if your goal is to do eccentric loads and strengthen the tendon. So, you just use it as a clinical tool. And I think that's, you've been practicing a long time. That's what happens after a while when you're in practice. You go, what do people need? You can't say, hey, you need a $400 orthotic for this if they've got kind of a good foot type. People send me patients all the time for orthotics, and probably 3/4 of them I don't make them on, but when you do make them, they love them. I mean, the patient satisfaction with orthotics is as high as it is with hip replacements. It's like 90+%. But this is a nice option for those in between people.
Yep. And then with the toe strengthening device, is that something that is individual purchase, like the patient would bring it home, or is this more for the clinical and
Well, a lot of
training?
clinicians buy it in bulk because there's discounts when you buy 10, and they keep it in their office. But most of them, from what I would see on the movement on the site, it's doctors recommending it to patients in their town. And a lot of PTs and trainers will have them in their office. Clubs will have them. You can wear minimalist shoes and use it. So most of the purchasers are individual, but I'm noticing over the past 6 months, we're getting more bulk orders from doctors who've seen the benefits of it. Because this was great research. They showed that the amount of pronation you go through doesn't predict injury, but if you're weak in a pronator, you get injured. If you're strong in a pronator, you don't. And they also showed that pronators who are given strengthening exercises for their intrinsics get faster, whereas people with neutral arches don't have that much of a change. So an overpronator and older people, 40% of people over 70 fall annually. The best predictor of it is toe strength.
It's
And
interesting because you mentioned the pronators. I've done a lot with the NFL. I've been in the NFL Combine for about 12 years. So that would be the sport or the particular athlete and the professional level that I've done the most with, and so many of them have uh, pronated feet,
mhm.
and obviously so many of them suffer from toe injuries, foot injuries, ankle injuries, and things like that. And so I could just imagine how beneficial this would be for them.
Yeah, I never dealt with anybody in the NFL previously
Mhm.
because I've kind of specialized in runners. And recently, an NFL player, who's a nice guy, reached out to me because he had an injury, and
Yep.
he researched it himself.
Huh.
So I've had him doing the toe pro with a couple of different trainers, and the importance of strengthening those intrinsics. The smart ones figure it out. This guy figured it out on his own. And I'm surprised. I think what happened with the NBA, where first it was like one team, then another,
Yeah.
because all the trainers kind of work with each other.
Yep.
I have a feeling pretty soon that they're going to realize that toe strength is really important in the NFL.
Oh yeah, I mean it makes all the sense in the world for sure. So cool, interesting. So that
Yeah.
makes a nice little transition out of patient care. You're going to stay busy. I'm actually in a similar situation. I am exiting patient care in actually 5 weeks from the date of recording this.
Holy mackerel, you left that
Yeah.
one out. That's a big, hey,
Yeah,
congratulations.
thank you. Yeah, I'm still going to own and operate it. I got two great docs here. I'm going to still provide leadership with that, but
Right.
everything is taken off with the Modern Chiropractic Marketing Group and the Chiropractic Success Academy, and so I'm going to focus a lot on that. And I have two young kids, so I got an
Good for
opportunity
you.
to yeah
Yeah.
to kind of
Yeah.
do that.
It's good, and then it's the different. It's the creative side. That's what I like about all the new changes that I've been going through. Is like
Hmm.
I'm hitting a point where so many interesting things are happening. I don't
Yep.
want to go into work because I want to do all these other things.
Yeah, yeah.
And that's good. You beat me by I think 10 or 15 years. So
Yeah,
congratulations.
yeah, thank you. It's interesting because I've talked about this a ton, but I'm a member of Strategic Coach, which is an entrepreneur coaching group. It's just been very transformational for me since 2013 of how to be more of an entrepreneur in a lot of ways. And they talk a lot about honing in on your unique abilities. And those are the things that truly fascinate and motivate you. And I've narrowed it down for me as to, creating vision, creating content, and ultimately just creating relationships. And so it all falls into this creating part of things. And like being able to interview you on a podcast is part of not only creating content but also creating a relationship. And so I'm really doubling down on that.
Good.
And it sounds like you're going to be doubling down on, creating as well. And so it's exciting.
Yeah, it's exciting. It's a little different. I think sometimes they're mutually exclusive. What makes you good at treating a patient sometimes with me is that like I really care about people.
Mhm.
I'm focused and I'm in there. And it's a pleasant environment where you don't have to deal with the craziness that
Mhm.
I'm experiencing now occasionally in the business world, where
Yes.
you try to have things made and like at 40 years of dealing with, like in a nice environment that it's kind of sheltered,
Mhm.
going out into the business world where you can get it, you can have a manufacturer like not make something that doesn't work and you're out $20,000. Something else happens where you've got to start all over. And I don't really like the business side of things.
Mhm.
But I'm going to hopefully be hooking up with some other people soon to help me with that because everybody's got their strengths and running a business is not one of mine. Luckily, I have my wife running the website and
Mhm.
setting up all the Instagram stuff because like I never really take a look at that even.
Yeah, there's a good concept from Strategic Coach. It's called who, not how. And that just means find the who can do it for you instead of how to do it yourself.
Good. I wish I talked to you a year ago.
Yeah, I'm trying to just get as many experts around me to do the stuff I'm not good at, or at least not fascinated by. So,
You're smarter than me. I cannot delegate. Like even like last year, I painted my house. I wanted a kitchen. I rebuilt my kitchen. Like I can't even hire plumbers. Like I just
yeah,
do it all myself. In
I
fact, when I
actually,
yeah,
yeah, I have a funny story about that. I grabbed my 68-year-old dad over to help me paint part of the outside of the house, and it's got, I'm down in South Florida, it's all stucco house and everything. And I look over and my poor dad's sweating his ass off. He's good at painting, but it's hard work, as you know. And I just looked at it and I was like, what the hell am I doing? I was like, let's stop. And I just hired someone, paid the money to do it. And I just, I
Well,
was
well,
like, man,
last year I decided that my house needed to be painted, and I've always painted it. It's not like
mhm,
my wife is smart. She'll call up, get an estimate. And I used to do these jobs when I was in my teens and 20s, and we worked for
mhm,
$3 an hour. So
yep,
someone will come over and say, I want $15,000. I'm like, I can do that in a week.
yep, yep.
So, so, so I told her when we finished this one, I said, this is the last time I'm ever doing
Yeah,
this.
yeah. Write the check.
Yeah, exactly. And it was like, not a big deal.
Yeah, write the check. So,
Exactly.
well, are you gonna move down to Florida like everybody else when they
No,
retire?
no, thanks, but no, I'm going to probably stay in this area, but spend winters traveling around.
Good.
So we got to pick a spot. I play a lot of tennis, South
Perfect.
Carolina, maybe Arizona, but yeah, this company is busier than my practice, and
Hmm.
Newton Biomechanics or human locomotion is going to take up way more time than the practice. Even like now, it's still probably 30 to 40 hours a week, but
Wow.
I'm going to learn to delegate.
Yeah, you're not retiring. You're just you're
Yeah,
just different chapter, right?
yeah, different
Wow.
chapter.
That's
Yeah,
exciting. It's and it's one of those things where it's just drawing you. It's that fascination and motivation, and it's going to be definitely exciting times to do that. I'm sure you'll miss patient care a little bit.
yeah. Again, because I interact with so many practitioners that and now I'm getting a lot of people asking me questions about rehab and what to
Hmm.
do with this one difficult patient. So, and I don't advertise that I do that, but a lot of people have been saying I've got this person with this. So I still feel like I'm playing a role in patient care.
Hmm. Yeah.
And who knows? I don't know if I can walk away from it. I'm like that horse that's behind another horse that just keeps following him. Um, I
Yeah.
don't look up. I could definitely see me practicing like at least 2 days a month.
Okay.
Yeah,
That's
yeah,
cool. And I like hearing the complete stories of, say, 40 years of practice, and not that it's fully complete, but you're putting a little bow on it and doing it the way you want to do it, and it's great. And a lot of our audience are younger chiropractors, and sometimes they can't see the forest through the trees, and it's maybe the student loans are a lot, or they haven't been able to get their own practice going yet, or the
mm,
economy is difficult right now.
right.
uh, when you go through this for 40 years, you've experienced all those different types of challenges, and it's always good to see that when you have that delayed gratification, that hard work over time, then it definitely pays off.
Yeah, it definitely pays off. And when I started practicing in '82, unemployment was crazy high. If you took a bank note out, it was at a 13% rate.
Yep.
But having said that, what the young students are going through with their amazing amount of debt,
Yeah.
I can't stand seeing. I
Yep.
just think it's terrible.
It's
Um,
bad,
yeah,
definitely.
it's crushing.
Yeah.
But there are so few people who are skilled. You
Hmm.
get skilled at what you do, and you will make it. It
You will, and what happens too is, like, yeah, the student loan thing is definitely not fun. Luckily, they have the income-based repayment part for each
right,
month. And then if you build something, you're going to have equity in it. You're going to have equity, whether it's your practice, your home, if you can buy your commercial real estate, or you're saving money. Like, you're going to be able to pay that off. It's just going to
right.
take a little longer than it did for maybe the rest of us. So,
Well, getting help from someone like you would be important because I remember when I got out, Western States was good at teaching us anatomy and
mhm,
biomechanics. I had no idea how to run a
mhm,
practice. I didn't.
yeah,
I stopped taking insurance 20 years ago just because
mhm,
I didn't know how to do billing.
yeah,
And I was fortunate enough that I had people coming in.
yeah,
I kept a low overhead practice, and it worked out well in
mhm.
spite of the fact that I knew nothing about how to run a business.
And
And
that's my kind of my massive transformative purpose with the profession. And even part of why I'm stepping out is that I think I can lend that dichotomy of, I've been on the clinical side, at a high level. I've had the practice. I know what it's like. I've been in the trenches, but then I've also done a lot to understand the business and marketing side of things. And I want the evidence informed chiropractic crowd to realize like you can be good at business and still be a great clinician, right? A lot of it is providing the ultimate patient experience and educating and good care, but you could be, very understanding of how business works and marketing and still be great clinically and be better off for it.
Yeah, and combining those two would be essential. I'm going to be working with Mike Carey, who is a chiropractor out in California. Used to be an associate with me for a couple of years, and he's doing a lot of work with the fascial distortion model. And we're going to be looking at making some educational videos. And I think if you couple improved clinical skills and then an awareness of all, like I was talking about with running human locomotion, the business side, like couple those two together. In the old days, life was simpler, and you just had to be a good clinician. Now you have to be both. I don't know how I would do if I was graduating now, if I didn't reach out and figure out, okay, I've got to do something to understand the business side of things.
I would say the good news is that the younger crowd does have a lot of good understanding of obviously social media and technology, and so they're able to leverage if they do their due diligence and they work hard, they're able to leverage those things a little bit better than maybe those that have graduated in the 80s and 90s and such. So.
I agree. I've done a couple of lectures with Mark King and Brett, and met a bunch of the students, and they're an impressive group.
Yep.
And it's exciting. I want to be a part of that. I would love to do something to help students navigate through what is a great career, and just honing their skills. And they seem really motivated and bright. It's fun working with them.
Yeah, it's a great group. I know they get a lot of flack here and there, but no, they've got a lot of positives in their direction. They just need to realize that, and also realize that people like you and I that have been doing it for a while, that maybe are doing pretty well, it didn't happen overnight.
No.
Right? It just didn't happen.
It happened in spite of us.
Exactly. Yeah, that's exactly right. So I think that's part of the struggle too, is they see the Mark Kings and such and all that, and they're not there at year 3, and it's like, well, no one was there at year 3, so keep at it for sure. But
yeah, absolutely.
Well, I want to respect your time, and I really appreciate you coming on the show and continuing to push the envelope, which is great, and being a leader in the industry. How can our audience reach out and find your courses, your products, your books, all that type of stuff?
Humanlocomotion.com is the easiest way to look at all the different products we have. And I've put up a couple of different lectures on clinical biomechanics, gait analysis. But like I said, I'm going to be doing more with Mike Carey and the fascial distortion model. But right now, humanlocomotion.com has all of the information, all the different products. And then, Human Locomotion books got all the references.
Perfect. And I also want to I want to thank you from MPI standpoint too, as you've contributed a lot to not only the virtual summit they had in the past, but also the MPI Clinical Excellence channel, which is really doing well. Like, it's got such great content in there, where it's just a little small monthly membership fee, and you get 2 to 3 great video lessons from all kinds of experts in the MPI world. And so that's been awesome as well. So thank you on behalf of MPI for that.
It's not a problem. I'm telling you, Brett is a riot. Mark King is a classy guy. Taylor, phenomenal. Just great people. It's been fun.
Absolutely. So thank you for your time, Doc.
Absolutely. Good talking with you. Good luck with your retirement.
Thank you.
Hey, take care.
That is it for this week's episode. But before you leave, check us out at www.modernchiropracticmarketing.com for all kinds of free resources, such as blogs and the podcast episodes. We've got online courses. You can check out the Chiropractic Success Academy there, which is an amazing online coaching system for you at a very affordable monthly rate. There's a free online course on the modernchiropracticmarketing.com website, so check that out. If you're interested in some one-on-one coaching, we can do that as well. We have all kinds of resources for you there, and we would also truly appreciate if you could rate and review this podcast if you're getting valuable information out of it. I can't thank you enough, and we'll see you next week.